As I was doing my medical reading the other day, I came across an interesting article. This was interesting for me because here I am, decades out from just starting OBGYN and no longer doing obstetrics. And the article was talking about how do OBGYNs do cesarean sections. And it really is a very important question because if you can guess, the most common or most frequently done abdominal surgery, the most common, the most frequently performed abdominal surgery is a cesarean section, which means that in 2019, it's reported that over 1 million cesarean sections were performed. But then the interesting thing about cesarean sections, and I can personally attest to this, is that not every obstetrician performs a cesarean section the same way. For instance, sometimes the obstetrician wants the patient to receive an antibiotic prior to the surgical procedure. Sometimes the obstetrician wants the vagina cleaned out before performing a cesarean section. Sometimes a gynecologist will wait after the delivery of the baby for the placenta to spontaneously be released from the uterus, or other obstetricians will choose to, after the delivery of the baby, to actively remove the placenta. Some obstetricians like to close the layers, the uterine incision in layers using a particular type of suture, while another obstetrician may choose to not to close the uterus in layers and have yet another preference for suture used at the time of the closing. And so the article was asking, is there a best practice for the performance of a cesarean? Meaning, are there certain steps that when done lead to better outcomes? And are there certain steps that when done actually are counterproductive or may actually increase the risk for infection? And so what the authors of the study did was look at a number of cesarean sections, look at the teak, review the different steps involved in performing the surgery, and they came up with a list of these are the best practices that should be performed during a cesarean section, either to improve the outcome or to eliminate the possibility of contributing to a negative outcome. And the question is, should the procedure be standardized, or should the surgeon performing the procedure be allowed to use his or her own discretion in how he or she prefers the procedure to be done? And the conclusion was that the best optimal results are seen when the procedure is standardized, understanding that there are always exceptions, meaning that there will be circumstances where you may have to deviate from the standard procedure, but these are exceptions, and that residents in training will learn the standard procedure and everyone will essentially know how to do it the same way. And in light of the fact that this is the most common procedure done, abdominal procedure that's done, in light of the fact that almost 30% of the deliveries, if not more, are performed via cesarean section, given that we have an increasing number of maternal mortalities and maternal morbidities, I too am for the standard. I am for a standardized procedure that optimizes the best outcome whenever cesarean section is performed. Now, as a patient, how do you know? How do you know if your obstetrician is following the standardized procedure or not? And the reality is that there is no way of knowing. And anytime anyone has any type of surgery, there is no way of knowing what your surgeon does when you are sedated, and whether or not they will share with you what happened or what they actually do. My advice would be during the pregnancy to have a conversation with the obstetrician to find out if he or she, or more commonly, it's a she now, is aware of these recommended practices, and do they typically use them? And then you would have to trust that they will then be honest and forthcoming in their response. And this helps you to gauge your level of trust and transparency with the person that's going to be delivering, or with the team of doctors or healthcare providers or hospital that's going to be performing or delivering your child. And if there's any question or hesitancy in discussing this with you, that may be an indication that maybe you should go elsewhere. And so I say this as information sharing. I say this as an obstetrician who has seen cesareans done a number of different ways, who as a doctor in training had to learn the various preferences of attending physicians, who now says, I believe it's a good idea to have a standardized best practice for how do we perform a cesarean section.